for, gosh, well, since the start of the pandemic now. Not always funded through RISE. Really glad to be able to keep the sequence going. In the plenary, you are going to have the pleasure of hearing a bit more from me, hopefully in a slightly less waffly way. I really apologies to those of you who, according to the original agenda, were signed up because they were hoping to hear from DFE. I think it's fair to say that we are not quite in a place where DFE can talk to us about their plans. So that is why they're not here today. I will do my very best to do a little bit of crystal ball gazing, so that you can have a sense of what we are thinking the direction of travel might be. Just to be very clear, that is my crystal ball gazing. It is not government policy, but I will do my best. And we will, of course, make sure that we share with you as soon as we're aware anything concrete that does emerge. So we've got Sam Gomersall, who is our programme lead at the Council for Disabled Children and looks after the RISE programme for us. He's doing a short introduction to the local targeted area support that is on offer through the RISE programme. To those of you who might not be aware of it, hopefully you're most of you are aware of it, but you may not be aware of the detail of it. You'll also hopefully be aware that we have been running the What Works in Send programme as part of the RISE programme. And we've got Penny Smith and Sarah Gorin from the University of Warwick, who are going to be talking through the findings from their qualitative research on how local areas can support schools to improve inclusion. And obviously we do know that that is a big focus for government at the moment. So, and then you will have already heard from the lovely Phil, but Phil will be back on the agenda to take us through the National Learning Disability and Autism Programme's Partnerships for Inclusion of Neurodiversity in Schools, so the PINS programme. So I know lots of people really excited about that, so really great to get an update. I've seen in the chat that we have got a few people who haven't got their workshop invites or had forgotten to sign up for a workshop. So if you are one of those people, then do please email rise@ncb.org.uk and Joe will sort you out. So you may not necessarily get your first choice if that one is a bit oversubscribed. So yes, apparently I'm just looking at my notes here. We've only got 3 workshops with available space, so Joe will allocate you. We've also, just so that you know, got a national webinar on sharing learning from Send Improvement on the 25th of November. So Thea is going to be posting more details on that in the chat. So do have a look at that if you think that might be interesting. So Macy told me that would take me 5 minutes and she was very nearly right. I am now going on and Macy, just before I do go on, have I forgotten anything? Is there anything that you wanted me to say that I haven't covered?
No, I think you're all good, thank you.
Okay, brilliant. All right, and we're up to 179 now. So yeah, so I think we're good to go. Okay, so yeah, this is kind of my attempt, and apologies to anyone who has heard me say any of this before. I'll try and say it differently, but a sort of an attempt to kind of give an overview of where we're at the moment and where it is likely that we will be going. So if you could move on to my first slide, Macy. So I think it's really interesting. It's been the case for a little while, but looking at the Labour Party conference guide this week, I was really struck by the number of people who now want to say something about SEND. So we have absolutely moved from being a very niche topic area where a few of the geeks amongst us, flourished, to one where everybody thinks that they might have something to say about it. And I think that's for bad reasons, But I guess my sense is that actually good should come out of that. That actually all of the time that we were a niche area and people weren't taking us seriously enough, actually some of the really fundamentally important things that we needed to happen weren't likely to happen. And I think that actually now we're in a position where everybody is so concerned about the state of SEND and people are using words like crisis. That actually what that means is that we were one of the topics that the new government looked at on day one, not just in the first 100 days, not just in the first week, but on day one. So I think that it doesn't necessarily mean we will get all that we want, but I think that is a much better position to be in, even if we might be unhappy about why we're in that position. So you will know that we have a system in which best practice is absolutely possible. And I'm always really, really clear about that, because I never want us to be in a situation where we're saying that actually there's no point. There's no point trying because the system is set to fail. Because there is really good stuff that you can do for children and young people, and really good services, and lots of people are doing it. But just to be really clear, we can see from the work that we do how hard it is. So it requires staff to go above and beyond constantly in order to do that integration and working together that is actually what children and young people need. And accountability mechanisms are not set to SEND. So we do have a situation where you can have in your local area SEND inspection framework, you can have the local authority being criticised for the high number of exclusions in the local area, but you might have nearly all of the schools in that area getting, well, they might not all be outstanding, but you might have none of them criticised for the level of exclusions that they are instituting. So actually we're not joined up, at inspection level either. And the school inspection framework doesn't celebrate best practice around SEND. And then the other problem, I think, is just that whilst, we can see when local areas get a poor judgment, systemic failing, and they are asked to produce an improvement notice, we can see that generally health partners absolutely do come on board and join in and understand their role in that improvement journey. But just to be clear, all of those, the weight of the improvement mechanisms that follow a poor inspection do fall on the local authority. And it is possible for those ICBs who might be not minded to kind of, scoot out of the way. So that doesn't help either. We also have a system which requires the othering of children, rather than one which acknowledges different learning styles and processing skills, and which requires parents and carers to have sufficient capacity to work out how to access support. And I'm going to talk a bit more about that later, but I think that's something I think it's something that needs careful thinking about and unpicking, but I do think we need to think about it. Really interesting. I hope they won't mind me presaging, is that the right word? Anyway, slightly breaking their embargo, but I'm speaking later on today at an Institute of Education event where they're launching a meta-analysis of randomised controlled trials of interventions in schools for children with SEND. And one of the things that really struck me when I was looking at the pre-publication of that research is that there is no correlation between diagnosis and what is an effective intervention. So I think in a situation where we have a small amount of money, a small amount of money, or a finite amount of money, and a big need, we need to think about how we are spending our money and whether we're really thinking about outcomes, and whether we're using it in the way in which is going to get children and young people to the best possible place. We also have, and this possibly seems to be COVID related as well, but we have a rising number of children reaching early years without the expected level of speech, language and communication development. And I think one of the things that I find really disturbing about that is Speech and Language UK did an analysis which identified that 80% of those children, young people referred for CAMHS had speech, language and communication needs. So, you know, this isn't, you know, this is a bigger issue. And I think that goes back to the othering of children as well. I think the way in which we have set up the system, which requires families and children, young people to identify that there is something wrong with them before they get support, cannot be good for children, young people's mental health. And I will, so I imagine the IOE analysis will actually absolutely be released publicly, and I will make sure that we send a link round when we send all of the information after the event. Next slide, please, Macy. So I just want to remind you about where we were before the election. We were all to varying extents excited about the change programme. So I know lots of people have been concerned about just, you know, what will happen with the change programme, sort of at a meta level. Will it carry on existing? We don't have a formal announcement about that yet, but I think the mood music from government is very different to last time round. We had a big change in government. So lots of you will remember in 2009, you know, the day after the election, the Department for Children, Schools and Families were no more. Every child stopped mattering, and there was a bit of a scorched earth policy. That has not happened this time around. And for instance, if you look at things like stronger practice hubs, then that contract has been extended to give government time to think about, you know, where they've got vehicles that are moving in the right direction, they seem to be deciding to continue with that. So our expectation would be that the change programme will continue until the end of this financial year, as was originally envisaged by the last government, and that it is highly likely that there will be an extension. Because obviously we don't have a spending review yet, we just have a budget in November. What else? The other thing that I think is likely is that we will be focusing much more on this middle column. Well, the first column and the second column. So the enablers, the sort of the local area inclusion plans, and the data dashboard. And a real focus on ordinarily available provision and improving the inclusion practice in mainstream provision. Early speech and language for every child is at the stage where it is now about to be operational in every local authority area that has been set up in. So we should start to get the data rolling from that soon. And everybody seems really excited about the 3-tier AP. So I would, you know, if you were going to hold my feet to the fire and say, what will the government announce? I think the announcement will be that we will have a pivot to that first column. And that is all I will say for now. Macy, next slide, please. So I'm not going to read this out, but just a reminder of what was promised in the Labour Party manifesto, which, you know, we could possibly be, you know, a little bit optimistic about, despite the fact that, you know, Prime Minister has been quite downbeat when he's been speaking. But, you know, again, sort of going back to what I said at the beginning, when have we ever in the world of SEND been in any manifesto, let alone the 3 main party manifestos? So, you know, again, I think a good sign that we are front and centre. Next slide, please, Macy. So when I've been talking to people in the sector this week, I was on holiday previously, so not that, you know, I don't talk to people in the sector every week, but I don't talk to them when I'm on holiday. So one thing that really struck me was that a sense of frustration. So that actually people were really excited post the election. There was a sense of energy, a sense of optimism, and I don't think Women's Hour probably helped, but there was a bit of a sense of frustration that we hadn't yet had any kind of clear announcements about SEND. So I suppose one of the things I wanted to remind you about is that we might not have had a kind of a detailed policy announcement about what is going to happen, but that doesn't mean that things haven't been happening. So, you know, what did happen on day one is that the SEND division within DFE now sits within the schools division. Now, that's not without I'll come back to you in a minute, Julie. That's not without a few challenges for us at CDC, but it's got to be a good thing. So what that means is that we're not thinking about schools policy and then having to, on the side, you know, have the SEND division say to the schools unit, oh, by the way, you've forgotten children with SEND. What this should now mean is that all school policies are set and thought about with an SEND lens as well as you know, an achievement and attainment lens. And you know, and it has been sort of refreshing and encouraging that actually you know, the department are talking about children. They are talking about children and wanting children to reach their potential. So again, that's got to be a good thing. We're not just talking about achievement and attainment. So Ofsted will be revising the school inspection framework. There will be a greater focus on inclusion. I'm really hoping that you won't be able to get an outstanding grade unless you are good at inclusion. There is a review of the curriculum underway. So I know that some in the sector have been concerned about the fact that there aren't any parents or parent-facing charities on the curriculum review group. So I did have an opportunity to bring that up with and I've just completely forgotten her name, Professor Francis, who's running the curriculum review yesterday at a meeting, and she was. I mean, whether or not we agree with her, she was clear about their rationale, which was that they didn't want to be tokenistic, and they wanted to sort of get under the skin of curriculum review. So we're using experts, but they were absolutely clear that they needed to hear that voice and have that input. So I have asked them to be clear with us as soon as they can about what the process for that will be, and we'll make sure that you will get an opportunity to understand what that is and how to feed into it. So I'm sorry, I've forgotten my capital on C there. A children's wellbeing bill was announced in the King's speech. The idea behind that, to put children and their wellbeing at the heart of education and social care systems. Bit of a shame that it's not to put them at the heart of health systems as well, but you know, I'll come on to that in a second. Hopefully, you know, that could just be motherhood and apple pie, but let's hope that it's not. And again, at least children are being thought about seriously. And the Darzai review did mention children, and government have promised to raise the healthiest generation of children ever. Now, you know, for us in this field, we might worry that, you know, not that it's not really important, but that you know, pertains mostly to a focus on public health. But let's really push on all the fronts that we have to encourage it not just to be about public health, but to be about how we manage health systems in the way that best supports children, young people, and especially those with SEND. So I know that not everybody's got falling school roles, Julie, but I was taken in by the Today programme the other morning that was talking about some research about falling school roles, and excited and just kind of thinking about the possibilities really. So what they said in that piece was that because at the moment it's mostly in junior schools, is that they're looking to use that to help them fill the gap in nursery places. But I have been talking to the department about the opportunity that might present to us to make schools more friendly for those with sensory impairments. So can we use them for quiet rooms or sensory rooms so that actually children Yes, and it was London councils that that the Today programme were talking about. So just really making sure that any opportunity like that we absolutely pounce on and make sure that people are thinking about it. You know, if we haven't got a lot of money, then that is an opportunity that doesn't cost the government any more than they're currently spending. Well, maybe a little bit of, you know, zhuzhing money to change the nature of the room. But yeah, let's look at those. Macy, next slide, please. So what will happen? I kind of I didn't want to say too much about it, but obviously there was a fair bit of kerfuffle just after the election when the ISOS LGA CCN Community Councils Network report came. Oh, sorry about that. Our light's gone out. Sam will put it back on for me. It's number 1, Sam, top left. Okay, apparently we're just going to do this. Oh, the whole office has gone out. Luckily, the internet still seems to be working. So we'll just do this by candlelight. Sam switched on his torch. Who knew I should have stayed at home? So yes, so go back to the ISOS report and I'll try and I'm really hoping that it is true that my internet is still on. Just somebody speak to me briefly and tell me that we're still.
We can hear you.
We can hear you.
Okay.
Yeah, we can hear you.
All right. So thank you all. Oh, thank God for that. Right, the lights are back on. So ISOS report. So yeah, created a fair bit of kerfuffle, mostly because they said some things that were ill-advised, like let's get rid of tribunals. And that meant that people didn't really look at some of the things in there that they said that were actually quite sensible and that actually nobody disagrees with. So in terms of my analysis of what I think will happen, I'm kind of basing that on where there's definite consensus. Should there be a vision? Probably be a helpful thing. And I think actually that would energize everybody. Nobody disagrees with a national framework and standards. That was what the last government were working towards. And it is what it is currently on fast track within DfE. A more inclusive mainstream offer, you know, I can't see too many people disagreeing with that. Realigning powers and responsibilities. I've put a tick and a tilde next to that because I think we'll absolutely get that around schools and local authorities. I'm slightly more hesitant about whether or not we'll get that around ICBs as well. I'm hopeful because you know me, I'm a Pollyanna, but I'm going to be realistic. A national workforce strategy. I've put a tilde against that one because I think money means that we'll get one. Whether or not it will go as far as we think it needs to go is another matter. And legislative change. I think it's likely that we will have it. I think what we don't know is when. So I think the DfE will, and I think the DfE will be very cautious. They will think very carefully and very co-productively about how to proceed with it. And they are very clear about the lack of trust in the system and the crisis that the system is in. So I think if at all possible, they will delay any legislative change until the system is in a better state of health. Okay. Next slide, please, Macy. So this is what I think has to happen. So this is not completely cost neutral, but it's pretty cost neutral. What we can't have, if we're asking schools to be inclusive and to look after a broader range of children, we cannot ask them to do that on their own. And if we continue expecting them to commission their own expert resources in order to do that, we will fast run out of money that way. So we have to think about how we use the resources that we currently have in a better way. And I think that's on a number of fronts. So it's about, so and just sort of what sits behind this for me is some of those approaches that happen in local areas. So the sort of the Portsmouth model around neurodiversity, where you're much more kind of embedding that support into schools. And obviously that'll be completely relevant to what Phil's going to talk about in terms of the PINS programme, and obviously is partly what sits behind LSAC. So really, really trying to make sure that we take the resources that we have, that we use the workforce that we have to upskill the universal workforce, to support them to triage young people in a more effective way, so that actually you are looking at skilled professionals, only, basically seeing those children and young people with more complex needs, because actually most children and young people's needs are not very complex. They're just not currently being understood well enough. And if we can help the universal workforce understand those needs better and meet them better, then I think we might well have a health workforce that is no longer on its knees and actually has the capacity to do the jobs that they thought they were signing up to do. So, this is what I think has to happen. Whether or not it will happen, whether or not we would get DHSC to say this is what should happen, I don't know. But I know that there are some really forward-thinking ICBs who are moving along this trajectory. So if we can't get government to say this is what should happen because the health system is still too caught up in adult crises, then let's make sure that we do the right thing for children and young people. So, and that was all I wanted to say. And I've got no idea, Mason. I'm sure I've vastly overrun. And now Sam, who did say that he didn't need much time, has far less time than he thought he needed. So I'm going to, I won't take any questions. Maybe we'll have a chance for question at the end. But just to say, any questions that are in the chat, we will come back to at the end of the session. And I will have a look at all of them. So anyway, going to shut up now and pass over to Sam. Thank you very much.
Thanks, Amanda. Hopefully everyone can hear me. Would someone mind just telling me that they can hear me?
Yes. Yep.
Yeah. Brilliant. Super. Thanks. Okay, what I'm going to try and do is explain what the RISE partnership is and what it does, the sort of themes that we help local areas with, how we do this, and some upcoming events. And I'm going to do that all in 7 minutes, or I'm going to try to. So the Research and Improvement for SEND Excellence Programme and Partnership is a 3-year contract with the DFE. It should be enough to keep the lights on, but sometimes it doesn't work like that. It's a successor to DBOT, which is another acronym, and is all around responding to local areas, SEND inspection reports, and trying to continue the support for the sector and the system for embedding the SEND reforms and the Children and Families Act. Next slide, please, Mace, if that's all right. I think I can't actually see. I think my slides are.
Oh, do you want to?
That's okay. I think we're on it now. That's all good.
Yeah.
So there's 3 key areas of the RISE partnership. The first is targeted support for local areas, designed to meet local need and provide them some bespoke support. The second is a programme of national workforce development, so webinars, events like today, e-learnings and some training sessions, all identified, or the curriculums identified through asking the sector what they think it is that they need. And this year we had 450 responses to that survey, so thank you very much to anyone who contributed. And we have a series of trainings, webinars, e-learnings and events to try and work on some of those themes. The third is lot 2, and that's all around developing what works in SEND, which is a combination of some cutting edge research from the University of Warwick, all around what works in SEND, as well as creating or disseminating that information alongside case studies of what's working really well. And I've got a slide later on just to plug that a little bit, if that's all right. So next slide. So what are the sorts of themes that we work on? So we support local areas, we go into local area SEND partnerships and help them to develop and embed outcomes frameworks. And we work with them on participation and engagement with children, young people and families, whether that's supporting them to really understand what their young people, children and families are saying, or whether that's to develop kind of strategic charters and frameworks that help them do that. Data and joint commissioning we work on as well, trying to help local area SEND partnerships monitor and evaluate the work that they're doing, the services that they're providing, and the way that they're supporting children and young people in their local area. Naturally as well, a lot of the things that Amanda mentioned earlier on, that the change programme is working on, EHCPs and ordinarily available provision come into this. A huge aspect of the workforce survey results that we saw were all around trying to improve inclusion in schools, and we work with local areas, whether that's on training and around the Equality Act, or whether that's by getting people together to come and speak about how they might be able to change cultures, change hearts and minds on what inclusion looks like in their educational settings. The other couple of pieces there are we try and integrate social care more effectively in the SEND system. And finally, all around preparation for adulthood, our partner organisation, National Development Team for Inclusion, work to try and embed that culture from the earlier stages. Slides moved on, sorry. But in any case, the way that we do that is through 4 different ways. The first is through desk review. So we try and review strategies, frameworks, policies, tools that local areas and partnerships have in place. Whether that's SEND strategies, graduated approach frameworks and SEND toolkits that they're supporting schools with. The second is through multi-agency workshops. And I think if I can make one slight plug of the RISE programme, I think that's the thing that we think we're really able to do effectively. We bring people together from different agencies, and the one piece of feedback that I think we get more than anything else is that time spent with people that they wouldn't normally spend time with to work together to help improve a specific aspect of their SEND partnership, particularly trying to map and think about the systems and processes that they have in their local area. We also do some facilitated conversations with key stakeholders or families, children and young people. And then as part of a wider package, we often do a little bit of training for the local area SEND partnership on co-production, Equality Act or the EHC process as well. In terms of local area SEND partnerships looking to access this support, it's a Department for Education funded programme, and so all of that comes through the local area's DFE case lead, but you can contact us directly at rise@ncb.org.uk if that's something that you'd like to explore further. I've got 2 slides and I've got 2 minutes left. We're doing okay.
Doing brilliantly.
Hopefully the slides moved on. Brilliant. So this is Lot 1B, which is the second of the 2 or the second of 3 aspects of the RISE programme. And you can see what we're looking to do in the rest of the financial year, i.e. up to the end of March 2025. And Macy's helpfully put a link to all the training sessions which are available to be booked. So there's things on there around understanding preparation for adulthood. We've got 2 different training sessions which we're developing on improving inclusion in schools, effective communication and multi-agency working in the EHCP process, and data voice and commissioning. We've done various formats of those types of training sessions before, and they've gone down really well. So we offer some training sessions. We have 2 e-learning modules each year, and you can see the 2 that we're developing for this year. And then we have webinars and events as well, of which today is one. So I'll come back to that.
Sam, we can't hear you. You've gone on mute.
Somebody muted everyone. It's off mute now.
Brilliant. So I don't know where you left me, but I was just explaining around the Lot 1B curriculum for this year, so hopefully people can see on the screen what that looks like. Final slide, that's all right. So I just thought I'd do a quick plug for the EP framework, which is the Effective Practice Evidence Framework. This is part of lot 2, which, as I said earlier, combines research, which we'll hear a little bit more about from the University of Warwick shortly, and then case studies from what is working well in local areas and trying to support other local areas to learn from that. So the case studies arranged around these 7 themes that you can see on the screen are scored or marked against 2 key criteria. One, the strength of its evidence, so the methodology for evaluation, how long it's gone on for, the timing of its evaluation, and whether it's sustainable or not. And secondly, the breadth of impact, so the number of areas that are being supported by the specific case study. That is, in a nutshell, what the RISE partnership does. If you have any more questions, there's one in the chat, which is, do you provide training for partnership board members and share examples of best practice for the functioning and membership of SEND partnership boards? It's not something that we have done a lot of through the RISE programme, but I think more generally at CDC, that is something that I think we can offer. And again, maybe the RISE at NCB email address is a good one to email.
Probably worth saying that what we have done is quite a lot of work around improvement boards.
Yeah.
And we've now got a toolkit for improvement boards. So there's probably quite a lot of kind of learning that would read across. So that it'd probably be a relatively quick piece of work to do some thinking on that.
And that was all I wanted to share.
Well, that's brilliant. Thank you so much for doing that, Sam. Right, I can see that Sarah. Oh, we've got a little hand up. Go on then, quickly. Where's Mark?
I was going to do a reaction, Amanda. It's Sue.
Oh.
But I clicked the wrong one and my hand went up. So thanks for answering my question.
Excellent. Excellent. Right. Well, nice to hear from you. And I obviously, just for those of you who don't know, because I haven't whined about it enough, I've got a cataract at the moment. So my sight is appalling. So if I call you the wrong name, or it's because I literally can't see you, but I can, in a very blurred way, see that Penny and Sarah are there and ready to go. So really exciting to hear from you. And I'm sure, because this is the topic of the moment, Sarah and Penny, to hear what you learn about supporting how local areas can best support schools to improve inclusion. Over to you.
Brilliant. Okay, Maisie, do I need to take control now then?
Yeah, if you'd like to control the slides, if you take control now, I'll give that to you. Thank you.
Brilliant. Okay. Okie dokie. I think that's, can everyone still see that okay? You can see that.
Yeah, that's all good.
Thank
you.
Okay, lovely. Thanks so much, Amanda and Sam. It's lovely to be here with you today. We are very appreciative of being able to come and speak to you and tell you a little bit about our research. And as Sam said rightly, Penny and I'm Sarah Gorin. This is Penny, who you'll hear from in a little bit. We are part of the RISE partnership, as Sam was describing, and we undertake pieces of research or requested by RISE and the DFE, and we're here to tell you about this one today, which we're very excited about. And so this one is focused on looking at how SEND systems, so health, education, social care and other partners in local areas, can help support schools to do that really important inclusion of children and young people with SEND that we've been talking about. The pieces of research that we do, and it's the same with this one, are undertaken in a 6-month period. We do 2 pieces of research alongside each other, and the aim is to come out with a full research report and an executive summary. This one about inclusion, the research has been completed and a report should be out shortly, we hope. And that will go up on the What Works in SEND website, so everyone will be able to see that. So we're giving you a little sneak preview today. And what we're going to do today is to talk to you very quickly about the research aims and methods, and then focusing on telling you as much as we can fit in the time about actionable findings that hopefully you will find useful when you're thinking about how you can help support schools with the work they're doing to include children and young people. And I'm going to start the presentation, and then I'm going to pass over to Penny, who's going to do the second half of the presentation. And as with Amanda, please do put questions in the chat, and we will try to get to them if we can at the very end. If we can't, because of timings, we will get back to you if there's anything important there that you want to say. That's fine. Please do put it up in the chat. Okay, so I'm moving on to talk about now quickly the aims and objectives of what we wanted to do. So the research aimed to understand and explore the key ingredients that help local SEND systems, so those education, health and social care partners, also those parent carers, to facilitate inclusive practices in schools. And when we were thinking about doing this piece of research, we identified that although there's been lots of research, particularly around what needs to happen to support inclusion at a school level, there was less perhaps around, you know, what needs to happen, what's happening, or what needs to happen within the local authority and ICBs, and how parent carers may be involved in supporting activities that promote inclusion through parent carer forums. So I think we wanted to sort of start by saying, as Amanda did earlier, that we acknowledge that the challenges and the complexity and the constraints within which people are working at the moment to do this work. And in the main report, we do talk about the challenges that there are in implementing improvement. But today we're going to focus on telling you about the happy stuff, about the facilitators, about what you can do, you know, that actionable knowledge. And what we saw was working well in the local areas that we went to. We went to local areas in the research that were already positively engaged in developing approaches to inclusion. And the reasons for that were really to try to see what they were doing and how it was working well. So I'm going to move on to just outline the methods of what we did. So firstly, we did a review of 45 area SEND Ofsted and CQC inspections to try to understand better the narratives that were written into those around inclusion. I'm not going to be able to cover that in detail today. There is information on that part of the research throughout the research report. We drew on examples of where local areas were using inclusion in the main report, but we will focus today more on the case studies and what we learned through the case studies. So with the case studies, we went to 3 local areas that, like I say, were already positively engaged in developing their inclusive practice. And we talked to key stakeholders within those local SEND systems, including SEND and inclusion leads in local authorities, designated clinical officers, designated social care officers, parent carers, and we talked to schools, head teachers and SENCOs about what they wanted the local authority and the ICB to be providing to help support them better with inclusion. We also undertook a workshop. We were really lucky to be able to talk to the whole school SEND coordinators, who are a really experienced bunch of people, and include leaders from special schools, head teachers, SENCOs, inclusion leads across schools, a whole range of schools, special schools, and mainstream schools, including academies. And in total, within the research, we managed to reflect the views of 176 professionals and parent carers. that included 89 responses that we had from a detailed qualitative survey that we did to parent carers. So we were really fortunate, again, to have support of the National Network of Parent Carers, CIC, and they were really helpful for us in terms of facilitating us to be able to ask parent carers about their views on inclusion. We also wanted to represent the voices of children and young people. Unfortunately, because of the nature of the constraints on our time, we weren't able to talk to children and young people, but we were able to include some feedback. So the organisation Kids shared findings from a workshop that they'd undertaken with approximately 40 children and young people with SEND at the CDC Youth Matters Conference. So we were able to incorporate their voices through that, and they were talking there within that about successful transitions and what was important to them in terms of successful transitions. So that is weaved throughout the report. Okay, I'm just going to start in discussing the findings. I think, really important place to start is with looking at what parent carers had to say in the survey about what they thought would help support inclusion. And I think although what they talk about at times is more about the change they wanted to see in schools, we were able to think about, well, what does the local SEND system need to do to enable schools to be able to implement these kinds of suggestions and changes? And, they were talking about what they wanted was improved understanding of children's SEND needs within schools. They wanted, their children to have that kind of support, and they wanted better communication between schools and themselves about children's SEND needs. And so we were able to think, well, what is the local area SEND system able to put in place to really enable schools to have this kind of specialist knowledge and understanding that parents want them to have, and to enable this better communication and approach that works on a case-by-case basis flexibly with each individual child and young person. And we'll go on now to talk about one example of a local area who were putting some things in place to really try to address some of these things around support that parents were saying is really important. Okay, so I'm moving on to the next slide, which is talking about the importance of building a culture of inclusion. And here I'm drawing on one of the local case study areas. So this is one local area. I think it's probably important to say it is a unitary authority, so it's small. And that meant that perhaps it was a bit easier for them than a large area, for example, Kent, where it might be harder to put in the work to develop these relationships. It's obviously more challenging. But what they were doing was working on a cluster model. So they had a small number of schools allocated to a person within the local authority who was able to build those relationships with the individual schools, and the schools were able to feedback. So there was that feedback loop that meant that they were able to really, stay on the same page and develop those partnerships and that communication about, from schools back to the local authority about, what was working well and what they needed more of. So within this local authority, what was really good about what they were doing, I think, that struck us was they had what they called an inclusion partnership that was driving a lot of improvement around inclusion. And that was an educational partnership comprising of regional special schools, a local university, the local authority, alongside local primary and secondary school partners who all formed part of this alliance. The work that they were doing within that inclusion partnership included training to support schools to develop their provision for pupils with SEND. And they were working in a way that meant that they were disseminating research, they were developing networks. And that was really important to people working within schools, because they had a central point of contact if they needed to understand something better, if they wanted more information. They were able to go to the partnership and find that out. They also offered initial teacher training within that partnership, a primary PGCE with a SEND specialism, and they had an outreach service that was based in the same place as the inclusion partnership. And the outreach service was providing a range of support for children and young people in mainstream schools. And that was run by the same person who was running the inclusion partnership. And that was a dedicated team led by qualified teachers, but with a staff at teaching assistant level, working with pupils both individually and on a whole school basis. And so they were able to feed into the inclusion charter and strategy that was developed, and other interesting work that was happening in the local area was they had money from delivering better value, and they'd been reflecting on their practice, and as part of that they decided to undertake and develop an inclusion audit for schools. And this was something that wasn't anticipated to be done to schools. It was something that was anticipated to be done for schools themselves, to do it with children and families that were in their school. And so that was a self-evaluation tool. They were employing somebody with their delivering better value funding, and they had a chap who was absolutely brilliant, really knowledgeable about inclusion, really passionate. He was developing the audit with schools. He was going out and talking to schools, and he was his post was a dedicated post for 2 years to try to implement that work. And as part of that, schools were encouraged to reflect on their inclusive practice and, produce an action plan as part of that process. And that was then reflected on, and the process would be reviewed every year. And I think it was the way that was being undertaken that felt, that it was really positive, because of the role of the inclusion worker who was able to go out and really do that work in partnership. In this local area, they also had an ordinarily available provision guidance document that was providing clear guidance about the graduated approach for schools and parents, and providing suggestions of ways in which barriers to learning for children with SEN can be removed. They also felt in this local area that their autism in schools training had been really effective. And I think they spoke about what was effective about it being really about the way they were implementing the training. So it wasn't just about a one-off training, it was about implementing a change in the way of working. And also it was co-produced and co-delivered with parent carers. So they were doing all sorts of things as part of that, including learning walks around schools to identify areas for adaptation, support courses for children and young people with autism, and support for parent carers. At the end of the training, the schools had a whole school SEND review on their provision for autism. And then the important thing was that schools weren't being left with that. There was then action planning support and follow-ups of progress, top-up workshops on things that they perhaps needed they'd identified they needed more support with, and they were given regular bulletins. So it was an ongoing form of training. There were regular bulletins produced by the Inclusion Partnership, who were able to tell them about, things like the latest research findings and information about autism, and sharing some of that good practice across the local area. Okay, I'm just going to move very quickly on to talk about this one. And this was in another local area that had taken a different approach. They had developed a toolkit for inclusion. And I suppose, some of these things, I think, how much difference is that going to make? And I think what was happening with the toolkit that struck us was that, they'd co-produced it. So from the beginning, it had involvement of parent carers, and they were investing in the parent carer forum, and they were the parent carer forum were part of the delivery of the training. So they'd gone out into schools to talk to other parent carers, and that was really powerful. I think the way that they were implementing use of the toolkit, and they talked to us about the toolkit and about how they felt that when they went into schools, it was giving parents empowerment, and they were able to see what was the ordinarily available provision offer in the local area, and they then had that information which really helped them to be able to start to have some of the conversations with schools, and some of that communication that was highlighted by parent carers as being really important. So that was what was happening in that local area. And now I'm going to pass over to Penny, who is going to take over from me and talk you through the rest of the presentation. Okay, Pen?
Yeah, hi.
Thanks, Sarah. Just before you start,
yes.
Penny, just to say you've got 13 minutes left, so hopefully that is sufficient.
Okie dokie, I shall whiz through. Sarah, are you going to move the slides along for
yes,
me?
I will do. Right? Yeah.
Okay, so if you could move on then. So in the next couple of slides, I'm going to just talk about some of the characteristics that we found were important for inclusion. So what the real kind of key facilitators were. And leadership was right up there, really pivotal, and that was leadership across the system. So at local area partnership level and within school settings. And the quote here is from a director of children's services in one local area where a culture of open, honest communications highlighted, and the need for a joint focus on children with SEND to be really at the heart of that. And we thought this example was important because it really showed a leader role modeling what they were wanting to see permeating throughout the SEND partnership. And bravery and leadership was also really important. So that need to challenge as well as being very supportive of schools, to ensure that that message that SEND is everybody's business is permeating throughout. So sometimes this was referred to as by our participants as something called distributed leadership, which I'm sure people are familiar with. So that the idea that the inclusion doesn't just sit with the SENCO or sit with the head teacher, but leadership is the responsibility for all those working with children. And it should be a responsibility of everybody to make that happen. So could I have the next slide, please? So part of good leadership was ensuring positive partnerships with parents and carers. So really developing that trust and avoiding the alienation that we know that many parent carers are at risk of experiencing. So this slide sets out some of the ways in which local authority areas were attempting to overcome that and ensuring there was that visibility of leadership, that communication there, those regular and creative lines of communication and support. And so the sort of things we've got here, this included regular meetings between local authority SEND leads and the parent carer forum, which could serve as a way of sharing ideas and feedback, to offering wider parent carer community support and advice through drop-in sessions, social media links through Facebook, to, again, broaden that support, to really kind of be creative with how leaders were accessing and communicating and allowing parent carers to have, that opportunity to share concerns and to access information. Also, a Send Yes phone service, so parents could speak to experts about how to take things forward on individual cases. So could I have the next slide, please? So the next slide sets out an example that Sarah's already alluded to, actually, which we thought was useful to share from a case study area where schools have been clustered geographically and then had been assigned an SEND specialist. So there was a dedicated specialist working with clusters of schools to provide targeted support where needed. And that could include, for example, whole school training, or perhaps working with individual pupils. And there was the option for parents to self-refer, which was quite an important characteristic of the service, in that that took the pressure off the SENCO and the leaders to an extent, so that there was more of a way of parents having direct access to information and support. And this way of working was an example of partnership working across agencies, because it really supported a team around the school approach, as there was good connections and relationships between the allocated SEND specialists in the school clusters and other agencies, so social care and health within the local authority, to really provide support for children in a more holistic way. And there were plans to develop that model to perhaps provide clustered peer support and also joint training to other schools. So that kind of idea of schools working collectively together and organising themselves to really provide really effective support for inclusion. Okay, so I could have the next slide, please. And on this next slide, we summarise the facilitators of multi-agency partnership, that relationship between education, health and social care, which is really pivotal. And obviously included here is the cluster model, but also there are other examples we've got from our research of where there were developing links between schools and social care, for example. There was one example where trainee social workers were actually placed in schools to provide that link. Also, and the quote here is from a director of children's services, which underlines the need to focus on a tiered approach through the team around the school model. So really emphasising that need to focus on early help, early intervention to prevent issues from escalating. And the next slide, please. So in one of our case study areas, the local authority was using funding from Delivering Better Value to fund a team to focus on transitions across the full 0 to 25 age range. And this was really about recognising that those pinch points on that journey between 0 to 25, and to understand as well, and that parents, children and young people were not having the best experiences when it came to those transitions. And that was particularly at the post-16 stage, where there's that kind of that hackneyed phrase that but actually still very relevant, that parents and carers for children and families were feeling they were at a cliff edge. And in this service, there were transition workers that were offering practical advice and information on the availability of support in mainstream provision. So really kind of signposting parent carers to what was possible and what was available within mainstream, in what was ordinarily available, and building that trust so that this provision is and can continue to be inclusive, and parents were trusting that that was there for them in the mainstream. So the next slide, please. So this slide gives a flavour of what makes a difference in terms of the workforce for inclusion. And the quote here refers to how the Autism in Schools programme that Sarah was talking about, the training, was really helpful and made a significant difference to building a momentum for inclusive practices in one area. The programme was about embedding change in working practices, and involved a cycle of reviewing, supporting and action planning. So, it was a really good model, we found, in that there was opportunities for really embedding the work. There were check-ins that people had stuck to their action plans. There were top-up workshops. And it was a model that we had a lot of kind of feedback on, positive feedback. There were also other examples that flagged up here of workforce support and development for inclusion, which included SEND hubs for professionals, Senko networks, and also peer networking for Senkos and leaders. Can I have the next slide, please? So not very surprisingly, funding was mentioned as a facilitator for developing inclusive practices, but this wasn't always about more funding, and nor could it be, given that, as we've spoken about, the funding isn't finite, and there was where there was good practice, there were proactive leaders who were developing innovative and creative ways of directing funding. So really thinking within the boundaries that they were working within. So, for example, funding devolved to clusters, as we've talked about. But also there are examples of local area bidding systems where mainstream schools had the opportunity to bid for small grants from local authorities to develop resources for inclusion. So, for example, pupils were producing videos as part of their bids and co-producing business cases. And this funding was going towards projects such as improving outdoor spaces or developing sensory rooms or using spaces in different ways. It didn't have to involve huge amounts of money. It was just thinking creatively to ensure that facilities were more inclusive. So there weren't those barriers for children and young people with SEND. And the quote here is from an SEND SEND lead who just describes a couple of ways that they had been trying to use small amounts of funding really to really make a difference to some of those settings to enable them to be able to be more inclusive. Okay, can I have the next slide, please? So this is a vignette from the research which we thought illustrated how schools respond very differently to children with SEND. And this could be for a huge variety of reasons, but we thought it highlighted the potential disparities between schools and when it comes to adapting practices to facilitate inclusion. So this is about Mia, who's 7 years old and had multiple needs. So whilst Mia's parents had felt she had been dismissed at her first school, that was what they thought, and that her needs had not been taken seriously there, there's a contrast here with the second school where there had been much more of an inclusive ethos and she'd had a much better experience. And this school is described as mainstream adjacent. So whilst they were still mainstream, they were able to flex. They were able to really adapt the provision that was there. And perhaps this kind of speaks to the different learning styles Amanda alluded to earlier, that leaning into a needs-based led approach rather than a deficit model. So really thinking what can be done in schools to just make that difference. And in this example, the Senko had provided a number of tools, a number of resources that were available for all children. So children could dip in and out of them. So whilst it very much supported Mia, it also was supporting by default other children who could dip into that. Mia also, within her new school setting, there was a more holistic approach. There was an ethos that her needs were recognised beyond the school, and that there needed to be support from that the family required support from social care, and also they also kind of worked towards getting an EHCP for her. Okay, so the next slide, please. So just to flag up the other research we've been involved with, all of these are on the What Works in SEND website, and the links are there, so that's accessible for you. And the final slide, please. And finally, here's where to contact us, and we'd welcome any comments and questions if there's time. Thank you very much.
Thank you so much to both of you. You were dead on time. So if there's any really quick questions, you've got loads of questions in the chat, and I know you'll be brilliant and come back to people with any follows up. But Sarah has got an eager hand in there, so we'll take Sarah's question before we go on to Phil.
No, it wasn't. I'm so sorry, Amanda. I meant to react rather than raise my hand. Well, I guess I did react, but in the wrong way. Fantastic presentations. As I'm speaking, I might as well say thanks ever so much, Sarah and Penny. Great to hear from you. And I'm so sorry.
Don't apologize. I was just thinking you were like me, Sarah. I was in a meeting yesterday, and embarrassingly enough, with both the rounds of questions, I was there with my hand up first, and it reminded me of being back at school. You know, when the teacher just doesn't meet your eye because you've got your hand up again.
Yeah, absolutely.
I was that child. But yeah, Sarah and Penny, do you mind just reassuring people that you will follow up on any questions that they put in the chat?
Absolutely.
Yes,
yeah,
absolutely.
I've started to do that. So yeah, I will continue. It takes me a while to read things and reply, but I will get back to everyone who's asked a question. And please do get in touch. You know, if anyone wants further information or wants to have a chat with us, you know, you're very welcome to get in touch. We always welcome people, you know, getting in contact and telling us about their experiences. That's really nice. So please do.
Well, that's brilliant. Thank you so much. And here is Phil. It's lovely to see you, Phil. And as I've said a couple of times, I think people are going to be really excited to hear about this programme. So without further ado, I will introduce Phil, who is the deputy within the Learning Disability and Autism team at NHS England, leading on the Children Young People's programme. Phil, over to you.
Thanks, Amanda. Thanks, Amanda, and thank you for the invite. It's always nice when people kind of introduce what you're talking about as being interesting, and I hope I don't take away from that today, because I think this is a piece of work and a project that people are genuinely excited about across the partnership. And I would hate to think that because I turn up and say some words and show some slides, some of that passion is dampened. So if that's the case, what I would suggest is find out what's happening in your area. I guarantee it will be of interest to you if it's not something that you're aware of already, and there'll be ways to get involved in it. I'll say a little bit more about why it's exciting, hopefully, as I go through. It strikes me that I've not put my name on that, but my name's on the thing, isn't it? And there are ways to get in touch with me and the team that I'm sure most of you will be aware of. And if not, if you drop CDC a line, they'll put you in touch. And I'm happy to talk to people about the work. So PINs. I was making some notes ahead of this presentation, and I thought we do love acronyms, don't we, in health? A passion shared by education, I think. And the danger with acronyms sometimes is that the words are lost, and so it's really nice to have the words there as well. And I think the words are really important here. Partnerships. This is about working with partners in health, education, with families and children themselves, and thinking about what we can do collectively in an area where we don't always get things right. And so partnership's really important. Inclusion, we've just heard a lot about, and really reassuring listening to Sarah and Penny that we're getting a lot of the fundamentals right, I think, in how we think about and deliver this programme of work in terms of inclusion. And then something around obviously neurodiversity. I am the head of children in the Learning Disability and Autism programme, but this is broader than learning disability and autism. This is thinking about how we support children in primary schools with broader needs, where they might have additional needs or additional support needs, often before a point of diagnosis, and certainly in a way broader than learning disability and autism. Before I go on and present, I've included some high-level things. I've included a few kind of detailed bits because I wasn't quite sure how to pitch it, how familiar people might be with PINs. But again, at the outset, I was thinking, what is it that I really want people to kind of go away thinking about? And so the bones of the programme of work is that we're working with 40 integrated care boards. So we're working with pretty much every area of England in supporting schools to develop whole school approaches. So we've got 40 areas. Each of those areas are working with 40 primary schools. So we're working in total with 1,600 primary schools. So I think it's important to know that that's 10% of primary schools in England. And the programme of work is to improve, and I wrote this down as a sentence that I was really happy with, and I'll share how I got to the sentence as well. So to improve whole school approaches. So this isn't working with individual children and young people. This is working with schools, partnership around schools, something again that Sarah and Penny talked about in their presentation. So improve whole school approaches in areas where children are struggling. So thinking about what is it that being in school, what is it about being in school that's difficult, and how might we improve that experience for children and young people? So in areas where children are struggling, and I've talked about those children, that's children in the broadest sense. So how are we thinking about where things aren't going well for children? How might we support them by getting the environment, again, in the widest sense, right? And then I wrote where schools can do better. And so I ended up with a sentence that says, how do we improve whole school approaches where in areas where children are struggling, where schools can do better? And then I read it back and I crossed out schools and I wrote we, because this isn't about schools doing better. This is about that partnership doing better to support those children in those areas where they're struggling. So not only did I cross out schools and put we, I circled the we as well. So this is about improving whole school approaches where in areas where children are struggling, where we can do better. And I think that's what this is. And it's doing that in 40 schools in 40 areas. So that's what it is. So what are we aiming to do? So nice to hear about autism in schools and some of the impact that that's had, because that kind of was some of the forerunner to PINS, really. So we're taking some of the learning and looking at where some of the impact was on autism schools, and we're taking that forward. So again, for those who don't know, Autism in Schools is a programme of work where we worked with, I think, 300 plus secondary schools in thinking about how they might improve their support for autistic children and young people. And so the kind of tenets are the same. So we're looking to do similar things that we did in Autism in Schools in that work that we did in secondary schools, but looking to do that in primary schools and looking to do it for a broad group of children and young people. But the main approach is very similar. We're looking at strengthening partnerships between parents and schools. So again, really nice that chimes with Sarah and Penny's presentation, looking at how we can build trust between parents and schools, looking at how we can improve conversations between parents and schools and make those more useful, more meaningful. Looking at developing schools' confidence and expertise in supporting neurodiversity within their classrooms, whatever that might look like. Again, picking up on something that Amanda said earlier about this being broader, our approach being broader than attainment and attendance and achievement. This is about children thriving in the widest sense in schools and being supported in their classrooms to do that. And that's why it's really important that we as health partners are involved in that and we make our specialist services available to support that aim. Come on to that. Looking at how we improve the school environment, so the physical environment to support engagement in learning, because again, I wouldn't want that learning element to be lost, and hopefully that will come out in this presentation as well. And develop an inclusive culture that improves the efficacy of other interventions. Wandered off into health technical language there, I think, but just around making sure that the things that we do work well for those children and young people. So those were the aims of Autism in Schools. Those are carried forward and developed in PINS. So just to say something about the impact, if we can move on to the next slide. I don't know if that's moved on for people, or there we go. So the impact and of autism in schools and what we're looking to achieve in PINS. very similar, it's felt across those partnerships. So that it's felt by schools, it's felt by teachers, it's felt by local systems, it's felt by families, and it's felt by children themselves. So people kind of really coming together around those children and their needs. And the only things that I really want to pull out from this slide are those three little quotes in the at the bottom where a child is saying, I feel a lot happier, I feel confident, and I want to come to school. And I think if we can achieve that between us, then we're in a pretty good place. And actually, whatever our aims and goals are as different organisations and where we sit in different systems, the thing that we can always all agree on is that's what we are trying to achieve. And so there is something around coalescing, I hope that's the right word, around children, around their families. And we feel organisational system benefit as a result of doing that. If I can move on, I think the next slide goes into a little bit, and I think the slides are being shared, so I won't pull out all of these things. But again, just to say that the impact from autism in school, the positive benefit from autism in school, is felt by children and young people who feel more confident, make friends, more likely to want to come to school. It's felt by their parents in terms of those more honest and trusting relationships with school, and being able to raise some of the anxieties and share some of the successes. By school staff themselves, by feeling more confident in their capability and capacity to work with children and young people, and in schools in terms of culture, leadership and environment. So we want to take all of those things forward, and I think wider than that, because one of the things that we're beginning to see in PINS is that some of the benefits felt by the system, that health, local partners and education are starting to talk to each other in a way that they've not done since we've developed the ICBs, and they're beginning to talk to parent carer forums and families in a very different way, and so there is something around the system benefit around this as well. So that kind of broader strategic benefit of how people are starting to talk about how we support this group of children. Okay, if I can move us on. So that just important to hold those things in mind, that's where what it's born out of. Those are the kind of things that we're trying to take forward. So talked a little bit about this in terms of the overview of PINS. It's a Shared Outcomes Fund initiative. It's a year, broadly a year. It was actually a little bit longer than that in terms of and that year is looking at recruiting those primary schools, and then from September, October this year, doing some direct work into those schools, which I'll talk a little bit more about. It's about whole school approaches. It's time limited. It builds on autism in schools. So I think I've covered off most of those things. Thank you. Thank you. Key elements. So each project must cover 40 mainstream schools. So the next important part to say is that from a health, well, not from a health, that's not true to say. What we are looking to do to support schools in developing those all school approaches is make available 37.5 hours of face-to-face time, expert time. So that might be, we used to call it 5 days. So essentially, but you can think about it in whatever way is most helpful to think about it. We moved away from 5 days because what we were saying was that input from experts might be 2 hours within a session here and 4 hours here. It doesn't have to be a day at a time. But what we're looking to do is make available 5 days equivalent time of expert practitioner support and advice to help school leadership teams and others in schools think about how they might improve their approaches. So that might be a speech and language therapist. It might be an educational psychologist. It might be somebody from a mental health team. So it could be a whole range of specialist advice depending on how the school identifies that need. Menu of supports, the next bit I'll pick out. So I'm talking about how we improve our offer in those areas where children and young people are struggling. And I'll talk about the domains. I think, let me see, it's in the next couple of slides. Oh, there we go. As if by magic. It's great when that happens. So we're looking at a menu of support in these areas where we think we might do better. So there's something around culture and leadership. Again, really lovely that it chimes with what we've heard so far this morning. How we and there's some examples of what that might look like in that domain there. So that might be around developing policy. It might be around developing understanding and knowledge within a leadership team. It might be around citing governors in some of the work that might be going on, or some things, some priorities that they need to take forward for their school. So there's something around how does that school think about neurodiverse children and their offer at every level of that school. Teaching and learning, readiness to learn, mental health, sensory environment and communication. So what we are saying is we could develop offers in schools with each of those. And the way that schools would understand that is to do a self-assessment with their parent and carers, with professionals, with their clinical experts, with other people, to say, where are we as a school? What additional support might we need in some of these areas? How do we prioritise those areas? And that's where we are currently, I think, in terms of we've identified the schools, we're working through those self-assessments. So yeah, so I think I can take us on to the next slide. Okay, so hopefully what I've given is a sense of there are some things that we want to address. So we want to steer people's thinking to you know, there are some definite. You need to work with 40 schools. You need to think about your needs as a school, or needs of these children in these areas. You need to provide 5 days of expert support. But then there's flexibility within this to meet the needs of each individual school and each individual area, dependent on what's there already. So thinking about other things that might be there, like health sec or mental health in schools teams, or some other things. So schools might have different needs dependent on what's already happening. So there's a flexibility built into this. And so the practitioner support can be brought in from any service or team, dependent on what your need is in one of those areas. So it could be educational staff, it could be health service staff, it could be voluntary or community or private providers. It can be around training, but only where that builds the capacity within that school. So it's got to be guided by schools, and it's got to be part of that practitioner support. So lots of training the trainer type work to increase an understanding of neurodiversity and responses that work well in neurodiversity. And then ICBs will form local partnerships, local authorities, parent carer forums to deliver PINs. So again, it's not going to be in every area, because we're looking at ICBs to work with 40 schools. So ICBs might choose to do that on one local authority footprint. They might choose to do that across different local authority footprints. Very much, again, depending on where they are, what systems they might already have in place, whether they're building things from scratch in terms of project teams, all of those kind of things could determine that. And so we're supporting local partnerships in doing that, and can include any mainstream primary school within the footprint. And we've provided some data around attendance, attainment, and other things to support ICBs in doing that. So again, if I can move us on. The role of parent carer forums and PINs. So really important part of autism in schools, really important part of PINs is that we want to build in we want to co-produce at every level with children and young people and families. So what we are doing to include parent carers specifically is asking parent carer forums to work with ICBs and local authorities to develop the project. So be involved in school selection, be involved in the menu of support, be involved in the commissioning of the support elements, be involved in describing what that project looks like locally. So that's strategic involvement, and there's funding that's available through ICBs for that, to work with schools, parents, carers to strengthen relationships between schools, parents, carers and neurodiverse children in those settings. So there is something around how they support then the development of mini forums within schools, or mechanisms of communication between schools and families, and also to support the development of the co-production to facilitate service design and delivery. So really being involved in, again, at every level, a parents in school level, at a forum level, describing the types of input that would be most helpful to the school in meeting some of those needs for those children. So parent care forums are involved in conversations at every level around that. So just in terms of a national update where we are, we have 40 of the 42 ICBs in England delivering the PINS project, which I think is exceptional. I think it describes some of the excitement that we've talked about. So PINS is interesting because it's working in all of our challenged areas, and it's interesting that the pandemic's been mentioned this morning, because we I think forget sometimes the impact that the pandemic had on health, that it's had on education partners, that it's had on children in terms of their needs, and that it's had on families as well. And so when we started to develop PINS, we were asking challenged systems and people under very real pressure to engage in something additional. So to come together and work together. And so we recognise the challenge on children. We recognise the challenge on families, on parent carer forums, on local authorities, on schools, on health partners, on the professionals that we're asking to become involved, so speech and language therapists, other therapists, mental health practitioners. Every area of this is challenged, but despite that, we've got almost every area in the country to take PINS forward, as I've described. And the other two areas we're working with to keep them closely linked, to share the learning from PINS and to look at becoming involved if we progress the work beyond this year. So projects have selected all their schools. So most areas are up to 40 schools. Schools have completed the self-assessment, so they've worked out their needs across those 6 domains. ICBs have analysed the results of those, and they've started to commission providers to deliver support. So if, for example, providers say, actually, we really need to think about our physical environment, and we need somebody, an occupational therapist, to come and support us to think about that, we're in a position where ICBs have started to commission that direct support. And bearing in mind that might be a need, not just in one school, but it might be a need across the majority of schools in that area. So there are some significant kind of commissioning elements and provision challenges to this. Parent care organisations are delivering parental engagement sessions into schools. Majority of that is PCF. Some of that's been commissioned out, where the PCFs have not been in a position to support those particular local authorities or ICBs. Parent surveys are carried out in each school. That's been triangulated with the self-assessment data. So what do children think is working well and needs improving? What do parents think is working well? What do they think needs improving? What do school staff at every level, what do governors think is working well and needs improving? So we're really trying to pull all of that together. And then delivery of support into schools will commence for the majority of those projects in late September, October. So we've got a delivery window between September and March to really do the work, to bring the practitioners in, to support those whole school approaches. And within that time as well, we've got the national evaluation. So some real challenge about time, but I'll come on to that. We're meeting with ICB partners from a health delivery perspective monthly, well, from a program delivery expert monthly. So if I can move us on the themes, before I do that, sorry, there's themes arising from self-assessment. So there are, as you would expect, needs in each of the domains for the majority of schools. And these are some of the things that have come out. So a need for a better understanding of neurodivergent children and young people, understanding the health needs of neurodivergent children and young people, sensory environment and audits around sensory and physical environments, social communication, communication-friendly classrooms, inclusion of parent carers and developing policies, and understanding the data. So understanding where the areas of improvement and where we need to focus attention and where we need to focus attention. So those are the types of things that are arising. Those are what we're looking to respond to from late September, October. And then the last slide I think that I've got is themes arising from delivery. So some of the challenge that we've currently got in the system. Firstly, workforce. So frontline clinicians really see the value of this. So if we're talking again, and just it's difficult, isn't it? But to make a real example, if we're thinking about communication or language readiness in school, then there's a real appetite from speech and language therapists, professionals to go into school and support that. If you're looking at doing that in 40 schools, what's the mechanism by which we can do that? But there's a real appetite to do it. People see the benefit of doing that in terms of meeting some of these children's needs earlier, and ensuring that more that those needs don't become greater over time. So thinking about how we support primary school children at a point or pre-diagnosis in really kind of understanding and interacting with their peers will have a huge benefit in terms of their language communication, readiness to learn, and mental health. And we can see that there's just some challenge around releasing those staff. And so we're looking at how we can develop and commission and that workforce implication of that. And that's the type of learning that we want to take forward beyond PINS. How do we ensure that we continue to put in these earlier interventions on a broader level that might stop particular issues developing further for individual children? Hopefully I've expressed that well enough. Most models are going to use a mixed model of delivery, health education and voluntary sector. So we will be able to buy in some support in some of those areas. There is some flex within the system. There's some appetite. There are people who are working within the system that can maybe add some additionality. Support to schools is delivered in several ways. Most are planning to use training, coaching, mentoring, and support around audits, and really understanding their needs and bringing in the kind of training and support they need to address some of those gaps. Need to be flexibility in delivery. Where areas need to recruit or procure elements of their support offer, that's going to deliver their timescales. But again, there's a local commitment to that. So even beyond the length of the project, people are saying, oh, right, okay, we understand this need. We will meet this need and we will procure that within our business as usual if they can't deliver it within the programme of work. And then the burden of work on ICBs, and again, having looked at this, I might have languaged it different. So ICBs and their partners isn't right, I don't think. It's the work on that we're asking children and families to take on, parent carer forums to take on, local authorities, schools themselves, health partners, deliver it. So when we're talking about ICB and the partners, we're talking about all of those kind of moving parts in this programme of work. We're asking a lot at a very challenged time. And again, I think it speaks to people's understanding that this is the right thing to do. This is the right area to work in. These are children that need support early. That's enabling systems to find and families and all of that to find that capacity to really support this. We're also conscious that SEND inspections might impact on progress. Everything's tight. We need to get this done here. We need to get this done here. We need to get delivery here. That's good because it focuses people, I think. But also there's a challenge in that if your system's effectively closed down for a SEND inspection, it may well impact. So we're really conscious on that and working with partners to understand how that might impact. And then the last thing to say really is that ICBs and partners are increasingly focused on the legacy and sustainability of PINS. There's always a nervousness around time-limited programmes of work and how they might go forward. But again, one of the things that we've seen in autism in schools is where areas can see the benefit of doing the work, where they understand or better understand unmet need, they will commission a response to that continues forward. And so there is something about areas that are already saying, actually, we need to do this anyway. And so we're going to put this, and this in place. And then other areas are kind of saying, okay, what is it that works well in this? And again, I've referred quite a bit to Sarah's and Penny's presentation. What are the bits that work well for us in our school, in our area, and how might we embed those and take those forward? And those conversations are happening already. So sometimes before even the work has started, people are just understanding some of the pressure within their systems more. Just to finish with, I didn't intend to finish with this, but those two areas that didn't feel able to take pins forward made that decision in collaboration between health, education, and families, and the decision was very much, actually, I think this will put pressure on us that our relationships maybe can't quite sustain, and so what we need to do over this year is start really thinking about how we build robust relationships between partners. And so it's not that they've said we don't want to do that, that's too difficult. It's oh, this has been really good learning for us because we thought we'd be able to do this. Actually taking stock of where we are, working with 40 schools, working at pace, making project support available, talking to our parent carer forums, making sure that we've got the procurement things. There's a lot of asking here. And actually this is going to put pressure on our conversations at beginning point of relationships, and actually we want to focus on those relationships, and they are doing that, and we are continuing to support them doing that as well. So that's pins. Hopefully it's kind of giving you a sense of what it is, where it is. It feels big and it feels like there's a lot, but coming back to it, this is about partnerships, it's about working together, it's about inclusion, it's about children finding a place in their schools and being active and successful in schools, and it's about working with children where there's additional need through whole school approaches where we as a system can do better.
Thank you.
I think that's it.
Thank you so much, Phil. Now, I think I've been keeping an eye on the chat. I think as you went through, you answered quite a lot of the questions that were in there, but we have got a whole 3 minutes, which is the longest amount of time we've managed to secure for Q&A during the morning so far. So do switch your cameras on, people, and feel free to come. I would say the sort of the most the most excitable stream in the chat, Phil, is the one around sustainability. So obviously you've talked about business as usual, but I wonder whether you want to, I'm going to push you a bit and ask whether what's the leadership from NHS England going to be around this? Are we going to see a commitment to rolling it out in the long-term plan?
Okay, so that's an interesting question. I'm just kind of I'm trying to think about how to best answer it, because I don't think this is an NHS England program of work. So the program of work actually belongs to the DFE. So it's a DFE funded project, and it's pretty unique in that ourselves at NHS England are working as effectively delivery partners for the DFE and working into our ICBs to do that. So I think firstly it's important to recognise that this is very much a shared programme of work, and I think that's a real strength of it, as much as it can be. So and in terms of continuing it, there clearly are and are going to be conversations between the departments and Treasury around what we might want to do going forwards in this as a project. There are some elements that are time limited. So some of this is about testing, because it's a shared outcomes framework piece of work. It's about testing approaches. It's about testing innovative ways of working. We have an evaluation built into PINS, and hopefully what that will give us is a real sense of what is it that makes the difference. So when we're looking at these needs in these areas, what is it that makes the difference, and how might we commission that going forwards? So even should PINS not continue as a programme of work, and I'm not in a position to say whether it would or wouldn't. And again, there's a change in government to considering some of this as well. Some of the elements, certainly. So if this informs how we might arrange our specialist workforce to intervene early in such a way that will hopefully make sure that children's needs are met earlier, and that's the most important bit, but also make sure that referrals that reduces referrals for more complex issues that are dealt with earlier. It frees up our specialist services to see children whose needs are more complex, and hopefully reduces our waiting list. So that's some of what we're hoping will come out of PINS from a health perspective. And yes, we will look to how we can carry those approaches forward. So I think hopefully I've got to an answer that. I think there's two. In terms of whether PINS will continue beyond the year, I think it's determined by what the evaluation tells us, what more we would need to know, whether we want to roll this out as an approach in its entirety, whether that's a useful thing to do. And also at the same time, it's how do we learn from what we are currently doing in schools, where the impact is, where the difference is made, how we might continue elements of that forward as well. On a much more, so as I said, we're working 10% at primary schools, but what are the things that work, and how do we make sure that that's in every primary school and a benefit to every child? Very much how we're looking at it. So hopefully that answers the question.
Brilliant, thanks, Phil. And I can see that Jill, because nobody's turned the camera on, you're all being very shy this morning, or certainly nobody I can see. To be fair, I can't see many people at the top, so I might be completely misunderstanding the number of people who do have the cameras turned on. But Jill has put something in the chat about the difficulties of commissioning within the timeframes of the project, which just made me wonder, Phil, have you got any kind of community of practice for the PINS programs where they can come together and discuss those kind of hurdles, or is that something that it would be helpful for us to talk to DFE about within the RISE program?
No, we do have community practice, and that's very much a focus of that at this point. It's interesting, isn't it? 'Cause it's like a wave that you follow, I guess, yeah, I think that's very much where we are, and that's that you know, it's a recognisable challenge. Where do we find capacity in challenged services? How do we commission some additional capacity? What might that look like? And we're very much there. But yeah, there's community of practice. There is a futures, NHS Futures platform around PINS to share some of that learning across the system. And we did work with some early adopters who were a little bit in front and are sharing some of their practice. Although interestingly, some of the areas that were not early adopters have caught up and in some instances gone beyond where early adopters are because of the pace that people are working. So some areas already have these systems in place, some areas are developing from scratch, and that again is part of our learning, because it's a learning piece really. And so if we've not got capacity in commissioning organisations to commission at pace, then that's a challenge for us, and something that we need to address equally to the provision of services. And so again, two answers really. Yes, we're supporting areas in doing that, but also recognising that there's a challenge in that and some work that we need to do going forwards.
Brilliant, thanks, Phil. It's just me chatting away with Phil here, and obviously, you know, I love doing that, but is there anyone else who wants to grill Phil other than me?
Grill Phil, that's a nice acronym. That should be my final slide.
Well, I think we should start a podcast, Phil. I mean, you know, move aside all of these Radio 4 presenters. Grill Phil is where it's going to be at. Come on, Sue, tell me that is an actual hand and not you reacting.
I'm always the one who sticks my hand up, I know, because
we're girls together in that, Sue. Go ahead.
I was just going to ask, and I did put a question in the chat, but it's well back now because there's so much chat on this, what was the rationale for it ending in March when school's academic year finishes later? Because it felt to me as though you're sort of cutting that short for schools midway through their you know, coming up to Easter, when it would have been really helpful to have that right until the end of their academic year.
Thanks, Sue. Just before you answer that, Phil, so that we don't run out of time, now that I've been all excitable about the questions, I'll get Jane to come in with hers as well, and then you know what you've got to answer, and I might still be able to give people a break. Jane, you go ahead.
Good morning. Oh, good. Yes, it's good morning. It's good morning. It's really good. The PIN project, we're involved in it as a parent care forum, and we've just started having meetings with schools. And my question would be the same about the rationale of it ending in March. And is there any plans for it to continue or for it to be extended?
Brilliant. Thanks, Jane. Right, there you go, Phil. Luckily for me, you've only really got one question to answer.
Okay. So funding, it's a really good question with a really dull answer, which is just that it's how funding works between Treasury and departments. So it's in-year funding. I would go, I don't know if I'm danger of repeating myself, but I think it bears it. That if we identify work in this year that we need to pick up as health organisations, then we will pick that work up. You know, there will be a commitment to do that. And in terms of continuing the programme, it's interesting because I'm thinking, am I allowed? What am I allowed to say? But actually, I don't know very much, other than, as you would expect, we are having conversations around whether or not we can continue the programme and on what basis that would be. What I would say, though, is, you know, again, if we're saying, look, there's a real need to do this piece of work, and this clearly sits with health or it clearly sits with education, we will have conversations within our own organisations around how we take some of that forward. And that's very much what we've done with autism in schools. And so where, you know, autism in schools, again, is time limited in some respects, but we've seen in a number of regions and ICB areas, they've continued to commission what works well in autism in schools. They've continued to develop their relationship with parent carer forums. They've continued, so we would expect to see that. But yeah, it's a bit dry. It's how funding works, and it's a frustration for all of us.
Yeah,
thank you.
We've locally funded it for longer, but
brilliant.
It was just a question. Thanks very much.
Thank you, Sue, and thank you, Jane. Now, Julie, I'm really sorry. We're not going to get to you because I am going to give people a break, but will you